Hi everyone, hope you're doing well. So, certain tips with respect to the communication OSCEs of the practical exam. We already have a few videos in regards to certain tips and tricks for the communication OSCEs. I had a few earlier videos that we made as well, just to give you certain tips for getting a greater score or improving your score in the communication OSCEs. All right. So this video is basically more about having a patient-centered approach because that's so much important. That's something that the examiners really want to see when you're doing the communication OSCEs because that's how things work in Australia. That's what the examiners like to see candidates doing it, replicating it in the exam as well. All right. So basically, certain points in regard to communication OSCEs is that you see when you're presenting treatment options, especially in cases of aesthetic concern or for any case, regardless whether it's aesthetic concern or not, always involve the patient in your discussion. So much important. For example, asking questions from the patient, is there anything in particular that you have in mind? Have you read or are aware about the options available to you? Do you know anything in particular that you would like to discuss with me before I discuss the options available? So, these questions keep the examiner, the patient involved, interested, and makes them eager to give you more score because it is basically your presenting your communication OSCE case in a patient-centered approach, not only that you are the one who's speaking, right? Also, in certain cases, after presenting the treatment options or after presenting the treatment plan and giving all the advantage, disadvantage, and everything for each option of the treatment, ask the patient, is there anything in regards to the treatment plan or treatment option that you would like to discuss further or would like me to explain further? Are you happy on how we are going to proceed ahead? You know, it makes the examiner more eager to give you more score because you are including the patient's opinion, you are including the patient's discussion in your communication OSCEs. And then for consent cases, after that you have done everything, let's say after you have discussed the entire consent, treatment option, advantages, risks, complications, everything, um, tell them I would be providing you with everything we discussed in written form. Take your time to read it, and if you have any questions, I'll be happy to answer them. So, these statements, although they look quite significant, but believe me, it helps the examiner, it gives the examiner an impression that you are someone who likes to involve the patient in discussion rather than just throwing your treatment options or your discussion onto the patient. Because if you are doing that, it becomes a one-sided conversation. ADC hates that, and they are not going to hesitate in marking you down. So it's always the patient-centered approach. ADC knows, please remember, ADC knows you have the knowledge. They want to see how you convey it. And this also helps in real life as well because it's just how when you go to a patient, a dentist or any medical practitioner, if the that doctor or that GP is asking you for opinions, is asking you what you would like to get, if is asking you is everything clear, is asking you if you have any questions, is asking you would like me to discuss anything further, how would you feel? You will feel so good, right? That this doctor is involving me in this discussion, asking me for my opinion, asking me about my circumstances. The same goes for ADC, the same thing that the examiner wants to see and hear from you. All right? Thank you, and I hope you implement this point in your communication OSCEs.